Hello everybody. Today we will continue our lecture about anaphylaxis and talk about nursing process in anaphylaxis. We know the nursing process contains 5 steps. First one was assessment, and second was diagnosis, and third was planning, and fourth was implementation, and finally fifth step was evaluation. In the first one, in the assessment step, we collect information about patient situation. In this in anaphylaxis, we collect many informations about our patient, like history. We must obtain information about any recent food intake, medication ingestion, outdoor activities, exercises, exposure to insects, or unknown allergies. Symptoms of anaphylaxis usually begin with 5 to 30 minutes, and the earlier the signs and symptoms begin, the more severe the reaction. Often the signs and symptoms begin with skin and respiratory involvement, and we must ask family members about a family history of drug allergies or a history of previous reactions. Signs and symptoms of anaphylaxis. Actually, we can see it in many systems of our body, like in skin, we can see urticaria, we mean rash and flushing, angioedema we can see, also sneezing, conjunctival pruritus, swelling, diaphoresis. All of this we can see it in our skin. In respiratory, we can see nasal congestion, rhinorrhea, throat tightness, shortness of breath, cough, hoarseness, uh, bronchospasm, swelling of lips and tongue. In gastrointestinal, we can see nausea, vomiting, diarrhea, pain, cramping, cardiovascular tachycardia. In neurological system, it's rarely, but maybe it exists, like headache and seizure. Hypoxemia may lead to confusion. Yes, but generally we can see weakness, lightheadedness, sense of impending doom. All of these signs and symptoms, we can see it in anaphylaxis situation. In physical examination phase, also we collect information about patient situations. So we must note any havens which appear as well-defined areas of redness with raised borders and blanched centers. Generalized symptoms include flushing, tingling, pruritus, and angioedema in around the mouth, tongue, eyes, and hands. Wheezing, stridor, loss of the voice, and difficulty breathing indicate laryngeal edema and bronchospasm and may indicate the need for emergency intubation. Auscultate the patient's blood pressure with a high suspicion for hypertension. Auscultate the patient's heart to identify cardiac dysarrhythmias, which may precipitate vascular collapse. Palpate the patient's extremities for signs and cardiovascular compromise, such as weak peripheral pulses and delayed capillary refill. Primary nursing diagnosis. So we talked about assessment, and the next step is diagnosis. Diagnosis is often it is ineffective airway clearance related to laryngeal edema and bronchospasm, as evidenced by hoarseness, shortness of breath, and or apnea. Outcomes: respiratory status, gas exchange and ventilation, safety status, physical injury. Interventions: airway insertions, airway management, airway suctioning, oral health promotion, respiratory monitoring, ventilation assistance. And the next step was planning. So, planning and implementation. Here in this point, we have two implementation, collaborative and independent. In the collaborative, the plan of care depends on the severity of the reaction, but airway management is the first priority. We must remember it. Discontinue the administration of any possible allergen immediately. Consider applying a tourniquet to the extremity with the antigen source. This procedure can relate antigen exposure to the systemic circulation, but tourniquet needs to be released every 5 minutes, and it should not be left in the place longer than 30 minutes. We must be careful in this step. Complete an assessment of the patient's airway to ensure patency and adequate breathing. If the patient has airway compromise, endotracheal intubation and mechanical ventilation with oxygenation may be necessary. More severe or prolonged cases of anaphylactic shock are aggressively treated with the establishment of intravenous access and infusion of normal saline or lactate rangers solution, as well as supplemental oxygen therapy. The patient may require urinary gastrization to monitor urinary output during periods of instability. Independent implementation. Now, this phase is very important, so raise your concentration. Now, we will talk about independent interventions. The most important priority for nurses is to ensure adequacy of the airway, breathing, and circulation. Keep intubation equipment available for immediate use. Insert an oral or nasal airway if the patient is at risk for airway occlusion but has adequate breathing. Use an oral airway for unresponsive patients and a nasal airway for patients who are responsive. If endotracheal intubation is necessary, secure the tube firmly and suction the patient as needed to maintain the airway. If the patient has a compromised circulation that doesn't respond to pharmacologic interventions, begin cardiovascular resuscitation with chest compressions. Teach your patient and family how to prevent future allergic reactions. Explain the nature of the allergy, the signs and symptoms to expect, and measures to perform if the patient is exposed to the allergen. Teach the patient that if shortness of breath, difficulty swallowing, or the formation of the lump in the throat occurs, she or he should go to the emergency department immediately. So we must remember that carefully. If the allergen is a medication, make sure the patient and family understand that they must avoid the various sources of the medication in both prescription drugs and over-the-counter preparations for the rest of their lives. Encourage your patient to notify all healthcare providers of the allergy prior to treatment. In documentation phase, we must document more informations like adequacy of airway, patency of airway, ease of respirations, chest expansion, respiratory rate, presence of stridor or wheezes, skin assessment, swelling or rash or itching, cardiovascular assessment. We can write about changes in vital signs, particularly blood pressure and heart rate, skin color, cardiac rhythm, assessment of level of anxiety, degree of understanding, adjustment, and coping skills. Now, guidelines about discharge and home healthcare provide a complete explanation of all allergic responses and how to avoid future reactions. If the patient has a reaction to a food or medication, instruct the patient and family about the substance itself and all potential sources. If the patient has a food allergy, you may need to include a dietitian in the patient teaching. Encourage the patient to carry an anaphylaxis kit with epinephrine. Teach the patient and family to administer subcutaneous epinephrine in case of emergencies. Encourage the patient to wear an identification bracelet at all times that specifies the allergy. Now we finished our lecture about anaphylaxis. We talked about many points about anaphylaxis. See you next lecture in our channel, Nursing Knowledge. Thanks for everyone. See you.